All right, good morning, everybody. Thank you for joining us today for our monthly webinar module series. This is where we bring to you information about your application system, specifically about what we call upgraded eligibility or the upgraded applicant portal, integrated eligibility. And today we have a special topic that we are covering, and it's special because this is new updated guidance for all community partners about something that is required for you to do with every new applicant. And it is so important that we have covered it in the recertification training in brief, and we're also taking today's webinar to go more deeply into the topic and to create a space for question and answer. So we have about almost an hour and 15 minutes today to talk about providing the rights and responsibilities and the notice of privacy practices to your applicants. And we are going to be covering this in both the September and the October webinar. So you'll have two opportunities to join, and it will be recorded so you can listen to it or share it later. We do want to mention that past IE webinars are available on GroupSite. They're in the training section under additional training resources. We've provided a link here. This is webinar number 9. So we have 8 webinars before today that you can go and listen to bulk up your knowledge of our applicant portal and application system. Today's objectives are really, like I said, to take a deeper look at the rights and responsibilities and the notice of privacy practices. We're going to talk about what they are, why they're important, a little bit about what's in there so you know why they're important. We're really going to talk about this requirement to provide them, which is something that has always been there, but we have not given really thorough guidance like this before. We're going to talk about where to find them so that you know how to go and fetch them, what they contain, and tools to help you provide them to applicants. After all of that, we're going to talk about the importance of your organization documenting your process. So you need to make sure you have a standardized process for all applicants. It doesn't need to be exactly the same, but it needs to be in place so that you know that every time somebody applies, these documents are offered to them. And we're going to talk a little bit about documenting that process. And then we'll have time for Q&A. So Jessica, is there anything else you would like to add before we move on to the content?
No, sounds great.
Terrific. Okay, so the first thing is that rights and responsibilities and notice of privacy practices is a really big mouthful. So instead of saying all that, we're using an acronym, or for short, we're just, especially in writing, we're calling it the R&R and the NPP. So I'd like you to all get used to that because that's how we're referring to it, just to be brief and efficient. Now, right now, and always, workers provide these documents to all applicants, whether they're applying in person or even if they're applying over the phone. The workers at ODHS have ways to make sure that all applicants get these documents. So when a community partner is helping somebody apply, they also must make sure that you're providing these documents. And this has been happening naturally with in-person assisting. So when somebody comes to you and they were, let's say in the past, applying on a piece of paper on the paper application or even on the applicant portal, they are physically with you and they are looking at that application as you are entering the information. And at the end, you show them the read and sign section, or they look at it on the piece of paper that is the 7210 paper application. And they naturally see all of that information that they then sign to. But under these remote assisting conditions, we've realized that we need to give a little more guidance about how to provide them in all application scenarios. In fact, the hearings unit reported concerns that members were not seeing what they were signing. So that means that we need to meet these requirements when we are assisting, regardless of how we are assisting. So it happens in all instances. And making sure that we have that in place will not only ensure that applicants receive the information, regardless of how they're applying, but it will also support our agency's continued request to continue to provide remote assistance. Because as a little reminder, we are able to do remote assistance because of special permissions during the COVID emergency period. But we have heard that is very useful to you as community partners and to your clients and your communities. So we want to be able to ask to continue to do that beyond COVID. We need to make sure all of these procedures are in place, even for remote assistance, if we're going to do that. So I hope that's compelling. Jessica, did you want to add anything else?
You're doing great. Keep going.
Okay. So you might be asking, what are these things? What is the R&R and the NPP, the rights and responsibilities, and the notice of privacy practices? Well, the rights include what the applicant should expect from the agency. And I'm going to give you some more examples, but really core things like people have a right to appeal the agency's decision. They don't have to accept what the agency says. If they don't agree with it, there is a process to question it. That's one example. The responsibilities outline the applicant's obligations, things like how to keep their case up to date and what will happen if they don't. So applicants need to know all of their responsibilities that they're signing to so that they can be in compliance with what the system requires. And then the notice of privacy practices outline how we use the applicant's data. For example, how we use their social security number and when we might share their data. And that is very important for us to make sure applicants know how we're using their information. So applicants need to know what they can expect from us, which is their rights and their privacy, as well as what they're agreeing to, because at the end of the application, they sign. And what they are signing to is that they are signing that they have read and understand those rights and responsibilities. This is actually not a new requirement, right? This has been in place for a very long time. But our new ways of helping people have highlighted that we need to shore up our process. And that helps protect you as a community partner in your organization, and it also helps protect the applicant. And in order to do it correctly, certified assisters must provide applicants these documents before they sign the application. Because when they sign the application, they are agreeing that they have received them and understand them. Now, something to know is that these documents are required at the time of new applications, but not at renewal, and only the primary applicant needs to review them because that is the person who's signing the application. And ultimately, the other piece of this that goes along with it, and we'll talk about it at the end, is that applicants must know what information was submitted for them because they need to know if they need to submit any corrections or any changes. And knowing what information was submitted for them is something that's important during the new application and at renewals and when reporting changes. And we'll talk about it a bit later in this presentation. So these two things go together, right? Getting these documents at the time of application and knowing what somebody has submitted for you. Jessica, anything else before we go on?
I think just to add that we'll be talking more about the time frame on which people have to get these too. And I see a question came up about that. So yes, we will cover that.
Okay.
That was my question. If we should bring this up now. So we'll hold on that one until later.
Okay. Or you can bring it up now.
So the question is, after applying through one, they explain to clients that they'll mail their R&R and NNP, letting them know what they are signing on the signature page after reading the read and sign section. Is this okay?
Yeah, we will talk about that. So what we're going to do today is we're going to walk you through where these documents are, what they look like, and so that you can know as a community partner the scope of what needs to be provided to the client before they sign. And you can provide it in several ways, which we will discuss, and then you can back it up by sending them a copy. But there are you can't just give them a summary you can't just give them a summary and have them sign and then send them the full documents. They must really see the full scope of it before they sign. But we'll talk about the different ways to do that. All right, here's the core of what you and your organization need to do. The first thing you need to do is develop procedures to make sure that you're providing these documents to every applicant. And that's something that each of you will work with your team and your main contact and your manager on. And then you need to also develop a procedure to ensure that clients know what information was submitted for them. And we'll talk about how to do that. Sometimes that might just be having them watch the screen as you're entering their information, or it might be repeating it back to them as you enter it remotely. So it doesn't have to be very onerous, but it does need to make sure that it's happening. In addition to that, you will need to document your team's process for providing the documents so that we as an agency know that you have a process that you are following. And we'll give you some examples of what documentation can look like. And then lastly, we're going to ask you to document your team's process for reporting changes on behalf of members so that the agency knows that when members report changes to you, you have a way to do it that is consistent. And we're not going to ask you to submit any of these documented processes right away, but we do want you to be ready to share them if you are asked. So they do need to be on file and ready to share. So here's the core of it, and I know I already said it, but I'm going to say it again because I think it's really important and most pertinent to remote assistance, which a lot of us are still doing a lot of the time. The applicant must receive their documents, the rights and responsibilities, and notice of privacy practices before they sign the application, even if they're signing remotely. And that can be a challenge. So we are hopefully going to give you as many tools as possible to help make that happen. And the good news is they can view them on a piece of paper, right, in person or in their own space. They can view them on a screen, which means that if they are with you in person, you can turn your screen to them and they can look at it on your screen. Or you could send them electronically a link and they can open it up and look at it on their own screen. You could even send them screenshots through text. You could send it to them via snail mail, so they receive a piece of paper in their mailbox. Now, if you do that, they have to look at that piece of paper before they apply, so you would have to put off that application appointment, but that is one way to do it. You could deliver them verbally. You could read them out loud. I'm sure none of us are looking forward to doing that, but it is an option. And I have a little asterisk here, which leads to the note that these two documents are going to be available in audio format in the future, so that if you need to play them for somebody, you will be able to. And in fact, that is how the processing center does it. If somebody calls ODHS to apply for health coverage before they do that application, they must either be sent a link to and view or listen to the audio recordings of these documents. So that is what is happening right now. And we will make that functionality available to you as well as soon as we can. We are also open to whatever other methods you might have to share these documents. This is not an exhaustive list. It's just some examples of ways to provide things, but there may be others. And if there are others, you can certainly type them into the questions box and we can share them. David, is there anything right now? Any questions about ways to provide them or any other ideas?
So there were a few questions that came just before this slide. So I think that some of those got taken care of. If there was a way to print them. So it sounds like there is. So we're advocating that they could be mailed and things like that. And then someone asked if we could read them to them and then mail them a copy. So I think one of the questions that I'm not quite sure where would be a good time to land is that someone asks, if this does not apply to renewals, why does the renewal part 2 have the R&R?
Yeah, let's circle back to that one later.
Okay.
And that may be
That's great. So
that may be a Christy Garland. One of our policy team members might be able to answer that, or Jessica might be able to later.
So no problem. So the next question is, what happens if you get someone who just called at the last minute to apply due to urgency? Specifically, it looks like maybe a homeless scenario, and are we to tell them to wait? I have to mail you the R&R and NNP before you can apply? It seems like this could be a hindrance for folks.
Oh yeah, sorry.
Please.
I want to make it really clear that these are all equally valid ways, the ways on this slide. So if you are able to read it out loud to someone, you do not have to also send it to them in paper format unless that's something you'd like to offer or something they're requesting. It's completely fine to not have a physical copy that you are handing them if they are okay with that and the setting lends itself to maybe that verbal way to share it. And
Mm-hmm.
so there's no requirement that you absolutely have to send pages of documents to someone in addition to other things.
Thank you for that clarification. That's important.
So a couple more questions here. One is around audio format. If this is available via an 800 number, some clients will get charged by minute on cell phones. So maybe if we know some of the options around that yet, maybe we don't. That's one of the questions that came up.
Thank you. Noted and to be considered. Anything else right now?
Lots of expression. Yeah, lots of expression around members in different kinds of scenarios. Concern around people who are in mental health crisis. Concern around, if they're in the ER.
Maybe.
Can't quite see, but
yeah. What the fuck? All right, I think I'm back. Can you guys hear me?
Oh, yes.
Excellent. Sorry about that. I dropped off the internet and had to fix it.
And now we're seeing your screen,
Okay.
but it's not the presentation.
Oh, it's not. Interesting. Just a moment while I try to remedy.
I see a lot of great ideas about various ways to record and share the rights and responsibilities and privacy practices. And yeah, we will collect these and put them forward. Thank you all.
Okay. Hopefully you can see my screen now.
You're back.
Yay.
Yes.
Sorry about that. That was bizarre. Where did we leave off?
we answered a few questions, and then we've had a lot of ideas around possibilities of how the audio recording can be available or presented. And folks are, I think we were right before that, we were saying that there's some concern around that this could be a barrier meeting members where they're at, if they are in certain levels of crisis or different needs medically.
Gotcha. So what I'm hoping is that maybe I want to call it the processing center for ease and old terminology, but maybe the one customer service center team, i.e. Joey, might have some thoughts toward the end about when they have people call, and I don't know if they have people call that are in crisis. I don't know if that's really a role that community partners mostly play and the customer service team does not deal with. But if the customer service team does deal with it, the workers, maybe they have some input on how they handle that. So I'll put a placeholder in that for later. Should we move on?
One quick, maybe this is coming up, but there's some questions around multiple languages also, and are they available in multiple languages, etc. So if that's coming up, perfect. If not,
it's coming up, and the answer is yes. So All right, so let's talk about where you can find these documents. If you're applying in the applicant portal, and the applicant portal is available really only in English and Spanish, right? So the rights and responsibilities and notice of privacy practices are spread throughout the whole applicant portal. Most of the information appears on the sign and submit page, but it really is spread throughout. So because of that, if you're assisting remotely with the applicant portal, it might be easiest to simply provide standalone documents instead of trying to figure out where to read to people along the way. So that would be our recommendation right now. You can do whatever works for you, but we're just mentioning that because of that, that might be your best path or your easiest path. Now, if somebody is applying through a paper application or the PDF, that the notice of privacy practices is an appendix C of that paper application. So it's there. It also is a standalone document, which is Form 2090A. We've put a link to both of those here on this slide. So that's the notice of privacy practices. The full rights and responsibilities are not in the paper PDF application. And in fact, when people order the paper application, it always comes with an application guide. That is for many reasons, but one of them is that the full rights and responsibilities are found in that application guide on pages 11 through 16. And they are also available as a standalone document. So we've provided all of these links so that you have your various ways to access these documents. These documents are also available in a number of languages, and you can get those on the Forms server. And what I'm going to do in a moment is walk you through where to find these different documents and what they look like. And lastly, you can always request these documents for a client, or a client can request them directly by calling the One Customer Service Center and talking to the eligibility teams, or by sending, it can be sent via snail mail to a client from the workers, or you can email a request to have them sent from the workers. And you can use that Oregon.benefits email, which is for community partners and for members. So those are some of the ways that we have devised that you can get these documents to your client and find them. Let's see. All right, what I'm going to cover right now is some of the things that are in the rights and responsibilities and in the notice of what are in the rights and responsibilities, so that you can understand the scope of why it's important and what your clients will be reading about. This is not an exhaustive list. There is much more than this, but these are the things we wanted to point out so you can wrap your head around the kinds of things clients are signing to and agreeing they have read and understood. So some of the rights include a right to privacy, a right to get help with forms and applications and understanding what's being said, a right to language access, to accessing this process in their language. And we have tools for that. They have a right to access their own client records. They have a right to good cause protection. So if there's a fear of harm, that's considered good cause protection, and we can take extra measures to accommodate that. They have a right to know what the agency's decision-making timeframe is for each program, and they have a right to know about their eligibility within a certain amount of time. And they have a right to appeal an eligibility decision. They don't have to take the answer if they don't agree with it. There's a process for that. In fact, there's such a process for that. We have a whole webinar on it. It's the grievance system webinar, and we've put a link here to it in English and Spanish in case you'd like to know more. And there are many other rights that they are agreeing that they understand, but that is what they should expect from our agency. There are also a bunch of responsibilities that they are signing to. They are signing that they agree and understand that they need to provide their legal spouse information. They're signing that they understand their requirement to report changes. They are signing that they understand that OHP might have a right to access other money that's available to them. For example, if there is a settlement from an accident and they get paid a settlement and they have medical costs, OHP might have a right to some of that money to cover their medical costs. They're understanding that they have a requirement to pursue other resources. And there are a bunch of resources, including other health coverage, but there are many more that are in the application. They are agreeing that there will be eligibility time penalties if they got rid of some of their resources for under market value. We actually have a webinar that talks about those time penalties as well as other aspects of the non-Magi programs, and we've put a link here to that webinar. Their responsibilities include estate recovery, when the agency might recover some assets from their estate and when that is not applicable. And it's largely, in many, many cases, not applicable. But it's important for people to understand that if they go into long-term care and are found eligible for long-term care, there's this extra thing called estate recovery and what it is. And there's much more. So we just wanted to let you know that there's a bunch of stuff in there. And there, there's a link to the full rights and responsibilities online. This is the first page of it. It is many pages, but this is what the beginning of it looks like. And we've put a link here to get it. And of course, you can go onto the forms server and you can also get it there. And we're actually going to take a little tour of it right now. So I'm going to go out of this presentation and go into my browser and pull up the rights and responsibilities. So when you click on that link, this is what you get, your rights and responsibilities. And it is for all programs, so you should know that. And it really covers your rights, what you can expect from DHS and OHA. Let's see, you can ask for a hearing if you disagree with decisions. You know, I don't really, we've struggled with how much to go through each element of this, and I don't think we're going to. You as a community partner are not being asked to go through each element. You are being asked to make sure that clients receive this. And if they have questions, they can contact the processing center. The same as if they were applying on a paper application or calling over the phone. Whoops. So it goes on to what your responsibilities are, what you must do if you are in any DHS or OH program. And then it covers what you must do if you get food benefits, if you get TANF, and the other programs. And then it covers if you get medical assistance. Here are the pieces that you must, that are your responsibilities if you are getting medical assistance. So the medical assistance is peppered throughout this document, quite frankly. So when you are using the standalone document, if you're reading it, you'll need to parse out the pieces that are for medical assistance only. Or parse out the pieces that aren't for medical assistance. But this is what it looks like. It's fairly long. It's quite a document, and there's a lot in there. And this is why we can't summarize it, because there's so much in there that summarizing it just doesn't cut it. So they really need to know all of this information and have access to it. Let's see. All right, so that is the rights and responsibilities. Jessica, is there anything that you wanted to point out or say about this online standalone document for the R&R?
I think it's great. I mean, maybe not the most fascinating reading, but it's great reading for folks, especially if they're new and want to orient themselves to some of the many moving pieces. And I believe we're working on a version that would be only medical, but I'll defer to the policy folks to confirm or deny that.
Yeah, I was actually going to pop in earlier and say, yeah, we are working on a more streamlined medical only rights responsibilities. So stay tuned.
Thank you. All right.
There's a really straight ahead question in the chat that I think is good to ask. It's just straight up: are sisters expected to read 17 pages?
Well, like I said, I think the medical only will be, I know the medical only will be shorter. It won't be 17 pages, but it will still be long. And the answer is only if that's, I mean, if I were assisting, that would be my last resort, quite frankly. I would try to get the documents to people in different ways. But if that is the last resort and that's what you're resorting to, then I don't like the answer. I don't think any of us love the answer, but yes. Unless would anybody else like to add to that?
Well, I think we're hoping that some of the future options, like especially around recordings, if it can be available, that also isn't in, um, another burden around, using their cell minutes and things like that, that would be another preferred option. But that is one of the possibilities.
Yeah, I want to acknowledge that we're not presenting this to you thinking, oh, this is no big deal, go do this. We know this is a big deal. It is a heavy lift. When you are helping somebody in person, it is so much easier. This is one of the big challenges to remote assistance. And the one customer service center, the phone teams, they struggle with this too. So Joey may be able to chime in on some of this, but it's a challenge that we acknowledge, and it's hard to share in some ways because we know what a challenge it is. And yet at the very core, people must know what they're signing to before they sign it. We all want that for ourselves and for everybody else. Nobody wants to be having somebody agree to something that they don't know what they're agreeing to. That's not okay. Does anybody else want to chime in on that before we move on?
Well, I just want to add that this is the process and the documents that we currently have today. And I understand that, this is what we're going with, but it doesn't mean that going forward, we don't want to hear ideas and we aren't willing to think outside the box or do things that we haven't done in the past. Like we are, this is what we have now. And we really, want that feedback to see how we can improve this process for everyone.
There is a comment that I think will tie into this too, is that people are if they're looking at their own processes and, feeling challenged by it, there's a suggestion in the chat that they email or text it to any individual that they can prior to an appointment, saying it really helps, and they're glad to have a link that they can send via text.
Absolutely. Thank you for sharing that.
There's also a question asking if we can share a little bit more about how the VEX offer this information to phone clients, and maybe Joey can help shed a little light on that part.
Why don't we talk about the notice of privacy practices and then have Joey talk about that? Is that okay?
Absolutely.
Okay. So the notice of privacy practices is found in Appendix C of the 7210 OHP paper or PDF application. It includes client rights, such as the right to choose confidential communications or to appoint someone as a representative. And it includes how we use and share health information and application data and more. So we are just going to take a quick look at that right now. Let's see, whoops, wrong browser. Here is the application. If you pull up the application from ohp.oregon.gov, at least the English version, this is what it looks like. And you have a whole table of contents on the side. And if you scroll down, you will see step 8 is where the read and sign section begins. So you can click on step 8, and there it is, your rights and responsibilities. You could take a phone, a screenshot or a phone picture of these pages and text them to somebody. And this is actually the read and sign section. But I want to point something out. On the last page of the read and sign section before somebody signs, and we'll make this bigger, hopefully, so we can see it. Okay. It says here, I understand and agree to the rights and responsibilities as explained in this application and in the application guide. I understand and agree to the information in the read and sign section of the application and in the application guide. And I have read and agree to the OHA notice of privacy practices found in Appendix C. So when a client signs their application, they are agreeing to having done that. So our role as somebody who's helping them apply is to make sure that they have those documents. You can click down here on Appendix C, and you can see the notice of privacy practices. It looks just like the one that's the standalone document online. And this is what it looks like. It's 4 pages. So that it is a bulk of information without a doubt. And now I think it's probably a good time if Joey has any comments about how the eligibility workers handle this when they have to help somebody get these documents.
So I'm not sure if you guys are looking for something more specific. I know that what you've shared as far as methods of delivery is largely repeat, so I can reiterate that. So our staff are trained to be able to provide it through email or listen to it in the audio recording, or it can be sent via snail mail. I'm not sure if you are looking for something more specific.
Maybe some thoughts, Joey, on the frequency of, I don't know if you have a sense of it, of how often they're shared in one way or another, and what, if your staff have any ways of handling urgent situations or people in mental health crisis, things like that. And you may not get those calls through the phone line, right? That may be something that community partners more uniquely handle. That's possible.
So as far as data tracked for which method of delivery is used more often, the only data that we may have available is if it's delivered through the audio recording. And I have requested that information when we first sort of started staffing the presentation of this content. And we're still looking at whether or not that's information we can pull. So we had some snags in that, and I'm not really able to speak to the frequencies in that regard. As far as crisis, moments of crisis, there is some conversation in our offline chat that it would likely be best to email in those instances and have the community partner work closely with the Oregonian to make sure they understand. And then just to make sure you're, in some instances, it may be like a conferencing in with the eligibility worker to ensure that they have that information. I feel like I'm concerned that these are very general responses to what could be a very specific situation. I don't have a lot of context, so it's difficult to know if I'm providing the best answer. I mean, as always, we're happy. I'm happy to dive in if there are other specific scenarios ever that you want to work through, if you feel like that's something that we can support with from an operational lens.
All right, well, thank you. I think we can all acknowledge that there are going to be some tough situations, and we're probably going to have to work together to figure out how to best accommodate them. So, something I did not, that I did want to go back and point out here is that in that paper application, under the read and sign section on the signing page, it does say that people are agreeing to having received the application guide and the rights and responsibilities and the read and sign section of the application guide. So this paper application does not actually contain all of the rights and responsibilities. One has to go to the application guide right here, and it's page 11 through 16. So you can go down to the bottom and go to page 11. And starting here is the read and sign section and the rights and responsibilities of the application guide. So it is agreeably in a few different places, which makes it challenging. So it's going to be a little bit of an adjustment to figure out where are these documents and how do we provide them based on how we're assisting somebody. That's something you and your teams need to get together and figure out. And if you want some support on that, we really encourage you to reach out to your ROC and say, hey, we need some help. Can you join our team meeting and help us figure this out? That is what we are here for. So I'm going to say it again, on the sign and submit page of the paper and PDF, it says, I understand and agree to the rights and responsibilities as explained in this application and in the application guide. So they are signing to that and they need to receive that. So it's, that's what this is about. Now the next section I'm going to let Jessica take, and we're going to talk about some sample talking points and some sample documentation. So if there are any other questions, David, that we should answer right now, we can do that, and then we'll move on to the next section.
There's a question around if the content can be moved to one location for assisters and community partners.
Mm-hmm. The easiest way to do it right now is, I'm going to go back to a slide. Which one is it? Right here. So where to find them. There is there are standalone documents for both of these. So you have the rights and responsibilities standalone document right here. Whoops, right here. And you have the notice of privacy practice standalone document right here. So you do have them in these two very distinct places. We're letting you know all the other places they exist as well. But when it comes down to it, those two, you can just save those and just use those for every situation. And that might be your easiest pathway. And again, the standalone document
And
for medical only will be forthcoming.
yeah, and I'll say, and looking forward, the standalone document, we're planning to include the notice of privacy practice with that. We still have to work through some logistics of that, but that's the plan right now. So again, we're trying to improve this process. Hopefully, we'll see that soon.
And if you send it to them beforehand and they have received it, and you now are meeting with them over the phone and you say, have you reviewed, your notice those two documents that I sent you, and they say, yes, I've received them, then you can move forward. They have received them and they've acknowledged that. Done. All right. So Jessica, I'll keep driving here, but I'll let you take over so people can listen
Yeah,
to a
thanks
different
so
voice.
much.
Yay.
Give you a tiny bit of a break. So I'm going to talk about just a few last points, including some sample talking points and documentation that might be useful to you and your organization. So one thing that you can say, and I'm just going to read this in its entirety because I think this is a really good example. You can say to the applicant, when you sign the OHP application, you agree to a set of rights and responsibilities, which outlines what your rights are, things like an appeals process if you don't agree with your eligibility decision, and your obligations, like reporting changes within 10 days and what can happen if you don't. You're also signing an agreement with the Notice of Privacy Practices, indicating that you understand how OHA and ODHS use your application data. You'll be able to review these documents before you sign the medical application. If you would like a printed or electronic copy, I can provide that. If you have any questions about your rights or responsibilities or notice of privacy practices, and I might add like that I can't answer today, then you can also contact your local ODHS office. We have people at the One Customer Service Center at this phone number, and you can also email Oregon.benefits. And I guess I did paraphrase that a little bit, but something along the lines of this really outlines that this is something that people should be able to understand. It's something that must be provided to them. And then you can offer the different ways in which your organization is able to provide the MPP and R&R. All right, let's go ahead. And so we haven't talked too much about providing a copy of submitted application information yet, so we're going to talk about that. The main point is that it's important that people know what has been submitted on their behalf, and that includes a new application, also reporting changes or renewals. Because if they don't know what has been reported, then they can't identify if they need to report a change or anything different, or maybe to fix something that's incorrect. Community partners must provide a copy of the applicant's submitted application if they request it. And thank you. So here is where to find the application information that has been submitted. In Applicant Portal, you have a few options to help someone understand what is being submitted. The first is, I think, something that Deanna already pointed out, but while you go through the application, you can have it set up in a way where the client can see everything you are typing and confirm that that information is what they mean to send into the state. You can also share it as the summary at the end of the application. So you can click through an applicant portal and see all of the different fields that have been filled out so far. And so that's a version of sharing the application information where they might not walk away with anything in their hand. Another option, and these are not mutually exclusive, is you can print out a PDF or send a PDF from Applicant Portal. It generates in the My Actions tab, which is at the top of the client's case dashboard. And if someone has their own account, they can also see all of those PDFs, any PDF that might generate. You can also get to it via your CP account. Oh, and I snuck ahead to the next bullet accidentally there. So either through the CP applicant portal view or the applicant's own applicant portal view, you should be able to get to any PDFs of information that was submitted through applicant portal. If you're helping someone remotely, you can repeat each answer back to confirm. So if someone can't see the screen, it's a good practice in general to repeat back the answers and make sure that people are understanding what is being submitted that way, or read it from like as you go or as a summary at the end of the application. And then if it's a paper application that you're helping someone with, then the client can look at the paper application or can be provided a copy or a scan of that application. And I'd say that is for a paper or PDF application. They can get a copy and they might be content with just looking it over before it gets submitted. Can we go to the next slide? Yes. So here's some sample talking points for providing a copy of the application. It is important to know what information I submitted for you because if there are any errors, it is your responsibility to correct them. I will show you or tell you what we are submitting before we send your application. If there are any corrections, you need to let me or the One Customer Service Center know right away. By signing this application, one thing you are agreeing to is that you will report any changes within 10 days. A community partner can help with that, or you can go to your local office, contact the One Customer Service Center directly, or report changes through your own applicant portal account. Or changes can also be, here now I'm ad-libbing again, can be sent into that Oregon.benefits email. So you can offer people a wide variety of ways to do that next step. Sorry, we can go ahead. And then this final section is about how to document your process within your organization. So we're asking that community partner organizations have in writing their process and plan for providing all of these different pieces to their clients. So specifically the rights and responsibilities and notice of privacy practices and that copy of any submitted application data. So document how the assisters at your organization will provide these documents, and you can provide a host of ways if there are multiple ways in which you're able to help folks. Check in regularly to ensure that your team is sharing these documents and everyone understands the process that you've documented. Make sure that procedure gets updated and note the date of any changes if it does get updated. And you don't have to proactively send this to your regional outreach coordinator, but we are here to help you and to answer any questions you may have. So you do not have to send it in advance to us, but just be ready to provide a copy of that procedure if it does get requested. I'm realizing we're running low on time, so I'm maybe talking a little fast. Here is some sample documentation of what that would look like to have it in writing. So XYZ organization ensures that each applicant reviews both the rights and responsibilities and notice of privacy practices before signing the application. We alert applicants they will be signing and attesting they have read and agreed to these documents. After the application, we review their information, alert them of the 10-day window to report any changes, and provide them with a paper or electronic copy of their submitted application whenever possible. Guidance on this procedure is included in our new assister orientation, and we regularly talk about it at our team meetings. So this is not exactly what you have to write, but is an example of something that could help you with maybe more or less details if there are specific ways in which you want to make sure you are providing all of these pieces. And this also includes, we want to do a shout out to also documenting the process for reporting changes, because it is important that you document your process for collecting and reporting changes on OHP cases and ensure that all of the assisters are implementing these practices as well. So these talking points are very similar to the last round, but I do want to point out that we haven't talked too much about reporting changes today, but it is very important. If someone trusts you as the community partner to get their information to the state, there should be a way that they they can know that that was successful. So if you're unable to report a change or unable to do it timely, it's really important to circle back to that member and let them know that their information hasn't yet been sent to the state because they are ultimately responsible for reporting that change. And if you're unable to do it for them because of maybe capacity issues or something else, it's really important that they understand if a change did actually successfully get to ODHS or not. And very similar to the last set, here's some sample documentation for reporting changes. XYZ organization offers to report changes for clients on OHP cases. We alert clients that it is their responsibility and that they have signed the application and must report changes to ODHS within 10 days. We offer to assist by reporting changes on their behalf. Members may call, email, or text us. We record the request in our client management database, so this is just an example, in the record for each client with a date of member interaction along with the date of submission to ODHS. We report changes to ODHS within 2 business days. If we're unable to do so within that time frame, we ask the client to contact ODHS directly or to work with another community partner. This guidance is included in our new CP orientation, and we regularly talk about it at our team meetings. So that is one example of how to document that you are tracking changes as they're reported.
And of course, that's the level of detail we're looking for, but the details for your organization will be different.
Yes, great point. I think this is our last talking point before we switch over. But we do have a guide that we have put together to support this work. It is called Providing the Rights and Responsibilities and Notice of Privacy Practices. And if you have been in a recertification, it should have been shared with you there. I think it's now in the Getting Started guide, and we have it up on group site. And it's even in, I believe, the notes, the handout section of this
It is.
webinar.
And, yep, the PowerPoint and the current guide is attached. And the guide will be updated as we have more resources, such as the audio recordings. So there will be updates going forward as we have more tools for you. So I think right now, I know that David had to drop off, but we have questions and we have until 10:15. So we have intentionally made this webinar a little bit longer because we always have a lot of questions and we want to make sure we have time to answer them. So Jessica, maybe we can start going through those and seeing who we have with us that can answer them. And Christy Garland may be with us now.
I have to admit, I was reading
Yep.
and I have not kept up on the question box. There's a lot. Oh my gosh, there's a lot here.
And I am looking as well. So it'll just take us a moment to gather our heads around which questions to tackle first.
I don't know if we want to go backwards and start with the documentation questions. What do you think?
I was not watching the questions earlier, so whatever your call is, Jessica, is fine.
Okay, yeah, I think, well, my brain's still focused on documentation, so maybe I'll make us do that.
Perfect.
So I see, so for documentation, is it acceptable to document in the system that your organization uses? And I say absolutely. We're not prescriptive about exactly, it could be as simple as a securely stored Excel spreadsheet, or it could be as fancy as a system that you are using to store other sort of patient or client information. As long as it's somewhere where you could find it later, and if you are asked to sort of show when something happened and how you could go back to that and find it. What do you think, Deanna? Was that a complete answer?
I was answering a different question via text, so I was not fully listening. I would. All right. We should move on.
Yes, so I think that's good. And And just to reiterate that this documentation doesn't need to be off the bat sent to anyone at the state. If you have questions or concerns, your ROC should be able to help you. And so I would recommend you reach out to them. Or if you are concerned that you're not sure if what you've written makes sense, we're happy to help. And I'd say your ROC is the first person. There may be a time in the future where something like an audit or in a hearings process, you may be asked, that probably will go through your ROC or someone in CPOP as well. So likely we will be the ones connecting with you about your documentation if we need it.
Great. I see a question here that I'll read. When we submit an application or submit changes, the application summary appears in messages. If a person chooses to receive documents by mail, can OHA mail it to them automatically, just like any other documents in their message center? My understanding is that that is not the case right now, and that we really do need to provide these documents, that there isn't an automated way to get them to clients.
Yeah, I think I would file that in the category of that's a great idea. I don't know what it would take to make it operational. So in the meantime, we have the guidance that we've shared today, but it's a great point.
Jessica, I'll read this one to you. Maybe you can answer it. Regarding documentation, would it be acceptable to document?
Oh, that's the one that I did while you were answering another question.
Thank you. Excellent. Done. I was at least honest that I was multitasking.
We both zeroed in on the same question. Let's see. Someone asked if the within 2 days is something that is required, or if that was just an example, and I believe that's just an example. I don't think it has to be exactly 2 days.
Nope, that's right. You should figure out at your organization what is a reasonable timeline. I think the big piece of that is that simply reporting a change to a community partner does not satisfy that client's responsibility to report the change to the agency. So we ask the community partners to be clear about that and just make a determination or a procedure of, if you can't, what do you do and what is that time frame for you? The next question, Jessica, is this program immediately implemented? I can address that. This has been ongoing. This is not starting now, right? This is something that has been going on. It has been required. We have not really needed to provide guidance in the past because application assistance was happening in person and this happened naturally. And we did give some guidance, but I don't think we fully, even our team, really understood all the documents and all the places. So we have now come to an understanding, and we need to make sure community partners are also with us in that understanding and with that procedure. So this is what is required. Please get together with your teams and make sure you are doing this. But because
we're
it's
not
ongoing, there's not a date. There's not a due date because it should already be happening in theory. So just work on it and shore up your processes if you need to.
Yeah, and I do want to also point out that this is something that has sort of been, and I think Deanna mentioned this, but remote assistance has sort of complicated this picture in many different ways. So we understand that there are lots of processes that worked really great when you were always face-to-face with someone and they were always seeing everything you were typing and reviewing every page with you of the application. And so we're trying to also evolve in a way that's going to continue to serve Oregonians as we get creative about the ways we're able to help them. And so this is one of the reasons why this has come to our attention, and it's a sort of a big push right now. And to honor that, like, gosh, we're all working and this will evolve as we continue to work to try to make this a little more straightforward for all of us.
Great. Jessica, maybe you can answer this next one. If the client wants us to mail them the OHP application because they don't have a computer or a printer, how do we make that happen? Should we direct them to OHP Customer Service Center, or is there another way?
I think there are a few different ways. Oh goodness, Deanna. If a community partner emails the OCE mailbox, can they do a one-off to a client, or does it have to be to their organization?
We have not been able to confirm that.
Okay. I would say they can get a paper application from any storefront ODHS office, so any self-sufficiency or APD office. I kind of hesitate to recommend they call the OHP Customer Service Center because that's
Mhm.
a really long wait to get
Yep.
something
But they could
mailed.
email.
But they could email as well. So all of these different methods we've talked about, I think they apply for how, other than the CP only tools, the Oregonian can use all of those as well.
Absolutely. And they can call a storefront office as well. So calling your local DHS
Great
office
point.
might be a lot quicker because they're going to answer their phone much more quickly than the central eligibility line.
And I do see a question asking if the current one applicant portal application has all of the rights and responsibilities and notice of privacy practices. And yes, so in theory, if you read through everything in the application on applicant portal out loud to someone, you have provided them with everything. It is interspersed throughout, so it's a little harder to track where all the pieces are.
I think we have one more question here. We do almost all of our applications in one. Is reading the rights and responsibilities on the sign and submit page, will that satisfy this requirement, or do we have to read the standalone documents?
That's a great question. And I
Mhm.
think the answer is somewhere in the middle because as I just mentioned, the different pieces of these different documents are interspersed throughout the application. So there's some at the very beginning, there's some at the very end. It's multiple pages. It's not just the sign and submit final page. And so that's where things get a little trickier. It's a little easier to track that you have done it if you use the standalone instead of what's written into applicant portal at this time. So I think I kind of lean towards the standalone instead of the language in applicant portal if you're doing
Mhm.
remote assistance.
I would ditto that. All right, so those are all the questions that I see right now. Jessica, is there anything else that you think we've missed that we want to cover before we wrap it up?
I think there's a lot of very similar questions. So if we kind of answered but didn't quite get to your question, I think the best way for us to do is to take a look outside of this because there's a lot in this question box. But just know that there is also another opportunity. We're going to go over this again, and we might have learned a little bit more in the intervening month. And so this is definitely not your last opportunity to talk about, ask questions, and sort of interrogate our process. But we are really glad that you joined us today.
In fact, I would encourage all of you to get together with your teams, begin to implement this, figure out what questions you have about it, and bring those back to the next webinar so we can all hear your questions and benefit from that discussion. But if you're not able to do that, you can reach out to your regional outreach coordinator. We are here to support you, and your questions will help us evolve our guidance. So we really want to be in communication. We recognize this can be challenging, especially for remote assistance, and we want to help figure out what you need to do it as easily as possible, even though easily might not be the right word for some cases. So we want to thank you for being here today. Thank you to all of our subject matter experts that were here on the back end chatting and helping answer some questions. And we look forward to continuing to hear your questions so that we can all learn together. So thanks for being with us. We will post this to group site. We'll send a follow-up email so that you have a link to the presentation, and we look forward to hearing from you.
Thank you. And thank you, Deanna. You put a lot of hard work into this, and it is not an easy thing to present on.
It is not an easy topic to wrap our heads around, so it's a big one, and it takes a team. It definitely takes a village.
And I believe the next webinar will be October
27th.
20. Yeah. Same time, same place.
All right, thanks everyone. Have a good Wednesday.
So
Bye all.